Thanks for staying with us on News at Prime. As hospitals across the country become increasingly overwhelmed with the second wave spreading rapidly, the health department says capacity at both private and public facilities is being expanded to create more space for COVID-19 patients. With cases expected to peak in the next few weeks in Gauteng, there are concerns that many hospitals in the province will not have enough beds to cope with the influx of new patients. Well, let's talk to the Mediclinic Southern Africa's Chief Clinical Officer, Gerrit de Villiers, about this issue. Good evening, Dr. de Villiers. A pleasure to have you on News at Prime tonight. If you can just give us a sense, firstly, of how your hospitals have been dealing with the influx of COVID-19 patients. And I think it would be also great if you can speak to the region, seeing that you are the regional officer.
Thank you very much. Yes, it is indeed so that we have seen the number of cases presenting in the Gauteng area with COVID dramatically increase much earlier than we expected and in much higher numbers than we expected. But this is a very similar pattern to what one saw in the Eastern Cape, Garland Route in Western Cape and KwaZulu-Natal, that it is seems as if this new variant spreads more easily and leads to a larger number of people presenting to our facilities. Fortunately, we have been in the position that it was over the Christmas season when our hospitals are traditionally quieter, and we've been able to accommodate many more patients. We also would dedicate certain areas and wards in the hospital for COVID specifically, and other for people who are negative, to keep them separate as to prevent infection inside the hospital. But our intensive care units and hard care units are under strain, then beds there are rapidly filling up.
Let's talk about what you're seeing in the rest of the Southern African region, because right now we have a situation where the country's borders have been shut down. Are you facing a situation at all where you have to move people between countries in order to facilitate their medical treatment?
No, fortunately not between countries. We have operations in Namibia as well, which is currently still coping with the patient load in that area. But we haven't had to move people around around countries. We have had to move people between towns at times to help them get to the necessary treatment, but not between countries.
Okay, let's talk about the collaboration with the public sector. The Gauteng Premier today saying that they had taken on some patients from the private sector simply because it too was becoming overwhelmed. What is Mediclinic's position?
As far as I know, we haven't referred any patients to the Gauteng Health Department for treatment. We have seen a few state patients for treatment in our facilities, not large numbers, but we are managing them and in contact with Gauteng DOH to see when we can transfer them or whether we should treat them in our facilities. But certainly, I think, in a crisis like this, there will be a bit of cross movement of patients between public and private, where the facilities are available and the patients can get the treatment they need. I don't think we currently have the capacity to see large numbers of state patients. So I think we will have to see how the situation develops in the next 2-3 weeks.
What is your approach to this situation, and I suppose also maybe a sense of the collaborative role that you see yourselves playing alongside government, if in fact we are only to reach our peak towards the end of January, beginning February, at what is expected to be almost double the numbers that we're seeing right now? It could be a complete crisis for the entire healthcare sector. So what is the position of Mediclinic going into that? What is going to be your approach to treating patients of COVID-19 in general, whether they're on medical aid or not?
Yeah, so currently we are mainly seeing medical aid patients, as that is the traditionally how things pan out. I do not foresee that with the current volumes and the volumes expected that we will have much capacity to treat state patients as well. I think we will mainly be seeing the private sector patients. We are not averse to work with government, and we have reached out and we are in collaborative meetings with them to see how we can cooperate and work together. We hope that the wave in the Western Cape subsides sufficiently that we can start moving equipment around the country again, up to Gauteng to assist Gauteng and some of the other provinces with their wave. Currently, the numbers in our Western Cape facilities are still quite high, and we haven't been able to move equipment up yet. So we will cooperate with the government, we'll move equipment around, we'll move staff around if necessary, but we expect to see a large number of cases coming to our facilities and the facilities will be under pressure, definitely.
Do you not foresee a situation where even private healthcare facilities are overcapacitated with an influx of patients, including those that are on medical aid? So before you even get to whether or not you can help with those that are in the public service?
Fortunately, there's good collaboration between the private facilities in the metropole areas to try and transfer patients where there are beds available. It happens on a daily basis. We have a call center that coordinates the calls between different facilities to try and spread out the load. One cannot really predict if you will at some time be completely overwhelmed. I mean, we were all very scared when we saw the images from Italy earlier in the year and from many other countries. Fortunately, we are not in a situation like that yet. And we will do our utmost to create additional capacity inside our facilities. That will be beds, staffing, equipment to try and absorb as many of those cases as we can. And one would obviously need to have the collaboration of the whole public and private sector to achieve that. In other words, all the private hospitals in the country will have to work together and admit COVID patients. And obviously the government will have to do its part as well. And then I think we will be able, South Africans are resilient. I'm sure we will be able to make plans and be able to handle this wave which is coming our way.
Do you feel any sense of responsibility to relax some of the procedures that govern private entities versus public entities, given the fact that we are in the middle of a pandemic?
So we have reached out to government for contracts to look after state patients with COVID. Those contracts are below cost for the medical providers. So definitely there is that solidarity in reaching out and provide those services when we can. Currently, we do not have the capacity to look after government patients as well in our Gauteng facilities.
Let's talk about the vaccine. I imagine it's also something that you at Mediclinic have been having conversations about. What is your approach to the announcements that have been made by the government in terms of its own vaccination programs?
Well, great excitement, first of all. We are very happy because we see this as the game changer in this illness. If it isn't for a vaccine, we will be struggling with this for a long time in the country. So we see this as a game changer. We are fully cooperating with the government in its rollout plans. Currently, as you know, there's enough doses for the healthcare workers, but we're actively collaborating and seeing if we can't source more doses from other places, from other suppliers, so we can vaccinate more people. We are very, very positive about the vaccine coming our way and really look forward to it arriving in the country by the end of January.
Do you have a view on whether government should be the sole distributor of vaccines in the country, or if private entities like yourselves should be given room to be able to procure it where possible?
That brings in the whole equity of this distribution. I think this is a disease that affects everyone in the population, and there should be equity of distribution. So I certainly think there's a role for public and private sector to procure. I think it's easy to regulate, to say for the private sector, for every dose you procure, you must give a dose to the public sector or sponsor a dose in the public sector, which is to a large extent what the medical aids are already doing. But certainly, if it's possible for the public sector, for the private sector to assist the government in procuring more vaccines, we would gladly help them and gladly procure more. We have an international footprint, as you know, so we have an international procurement department. So we would greatly like to assist government in procuring more vaccines for the country.
Is this a conversation that you're having at all with government?
Yes, we form part of the B4SA work stream that work through HASA, the Hospital Association, and our meeting with government. So those discussions have taken place already.
All right. Mediclinic Southern Africa's Chief Clinical Officer, Dr. Gerrit de Villiers. Thanks for